All set.
All set. Okay, welcome everybody. First and foremost, I'd like to introduce Sandra Cook. She is a member of Virginia Organizing's State Governing Board and an amazing leader in the Richmond area chapter. So welcome, Sandra.
Good evening, everyone. Welcome to Racism as a Public Health Crisis in Virginia. I've already been introduced. My name is Sandra Cook. I'm from Petersburg. I serve on the State Governing Board of Virginia Organizing, and I also serve with the Richmond chapter. For those of you who might not be aware of Virginia Organizing is a nonpartisan, statewide, grassroots organization dedicated to challenging injustice by empowering people of all communities to address issues that affect the quality of their lives. We have 16 chapters, and we work on local, state, and national issues. Tonight, we are gathering 2 days before Juneteenth. Juneteenth celebrates the resiliency of people of color in the United States and lift up racism as a public health crisis. And tonight, we also celebrate Juneteenth as a national holiday. We have a panel of speakers that are going to talk to us tonight. We're going to have a question and answer period after the panel speaks. And then, of course, if you know Virginia Organizing, we always have a call to action. And we're going to have that at the end. Now, I'd like to introduce our first speaker. Our first speaker is Delegate Lashrecse Aird. Delegate Aird is the delegate from the 63rd District. Delegate Aird is my delegate, and she is also my soror. Welcome, Delegate Aird. Please take it away.
Good evening, and thank you so much, Sandra, for that kind introduction. Again, I am Lashrecse Aird, and I have the pleasure of having served as the representative for this district since about 2016. At the onset of my comments, I want to thank Virginia Organizing for structuring this conversation this evening, as I believe is critically important. But I also want to thank all of the affiliated organizations that stood alongside me to help shepherd the resolution that formally declared racism as a public health crisis with this past General Assembly session. Tonight, I want to talk about two things. I want to start out talking about the difference between a resolution and a bill, because I believe that's important for setting the foundation and conversation for next steps. And then I want to speak specifically about the journey of this resolution and the resolution itself. So oftentimes we refer to the actions that occur during the General Assembly session as passing legislation broadly. This declaration to formally declare racism as a public health crisis is solely a resolution in the Commonwealth of Virginia. The reason as the patron I selected a resolution, and I often use this phrase, is because my mother once said, the first step in solving a problem is first admitting that you have a problem. The Commonwealth of Virginia, as mentioned in the resolution, is the site where the first enslaved African people arrived in what is now the United States, ultimately home of the former Confederacy. And quite frankly, I believe the foundation for the racism that exists in our country. We needed in the Commonwealth of Virginia to admit our responsibility in playing a role in that racism and acknowledging that this racism still very much exists today. But the primary difference in having a resolution versus an actual bill is that while it's not ceremonial, It's a policy statement that does not mandate specific action, but merely recommends specific action. I know there will be a call to action at the end of the program, but I'm just go ahead and say it. There is still a lot of work for us to do on this front. This is literally just step one. This is literally just laying the foundation for the work that must be done. The reason why this resolution was so important to me, and obviously so many others, is because when we talk about racism being a public health crisis, I directly align this declaration with the systemic and institutional racism that exists, particularly around the social determinants of health. And so to me, that means we're making the reference of health specifically, but this declaration goes beyond just health care in nature. This talks about everything that impacts your day-to-day living. So when we talk about systems and institutions, that can be in the category of the environment, what's going on in your community, the education system, the transportation systems. I can go on and on down the list. What we know is here in the Commonwealth, the way our systems and agencies and institutions are set up is that they are not providing fair and equitable resources and services to everyone, and that racism is baked into its system. The only way to truly eradicate this problem is to acknowledge it and then to begin to think through the steps of relaying that foundation. So really quickly, I want to talk about some of the very high level, broad, again, first step recommendations that we included in this resolution. We're asking that the Virginia Department of Health's Office of Health Equity to address racism as a public health crisis, that they conduct an assessment that then can provide specific recommendations back to policymakers like myself, whether that is by way of a law change, whether that is by way of a financial resources being allocated, or anything beyond that, but that this assessment is conducted so that we can take further action and have a roadmap of sorts. We then ask in this resolution that the Commission to Examine Racial Inequity in Virginia Law remains a permanent commission. This was a commission that was stood up under Governor Northam, but these commissions are not permanent. They can go away with the next administration. This commission has done some great work, but they are also at the beginning of assessing our current code of Virginia and getting laws off the books that are still racist in nature. In addition, we also ask that this resolution will train elected officials, staff members, and state employees to recognize how to combat implicit bias. And this is critical because we're not all arriving at this conversation of racism from the same place and seeing this issue through the same lenses. I will tell you, in trying to pass this resolution during the General Assembly session, it was an almost partisan vote, which means Democrats majority supported this and only one Republican supported this resolution. This is not a partisan issue. There is racism in our society, and this resolution is merely declaring it so. But because this became a partisan issue, that informs us that there are still people who do not understand, number one, the difference between the act of racism versus systemic and institutional racism. There are constituents that elected officials represent that do not acknowledge racism and do not want their leaders to acknowledge racism. And in order for us to all get on the same page about these next steps that we need to take, there needs to be a lens of understanding and a framework of words and references that we are all agreeing to operate from And that is what this training can possibly do. In addition to that, in support of that training, we're saying a glossary of terms be established. Is the word racism that I am using meaning the same thing that you believe it to mean? The establishment of this glossary of terms will help with that. And this is for all cultures, for all entities, racism across the board, and other terms that are affiliated with this conversation. And lastly, promote community engagement that will actively engage all citizens on the issues of racism. So many of the partnering organizations have played an incredible role in already beginning to do this work. But again, as long as we have communities of people that do not believe and acknowledge that racism exists, we cannot get to the ultimate solution of eradicating this racism in our systems and structures. And so this outreach that we must all collectively do together is critically important for us to both govern and to build stronger communities of understanding around this issue. So I am going to stop there. It was my honor and my pleasure to introduce this resolution, and again, to work alongside so many amazing organizations. I could not have done it alone. And again, this is only step one. I'm looking forward to the rest of the work that needs to go alongside this resolution, and I look forward to answering any questions later on in the program.
Thank you, thank you, thank you, Delegate Aird. Our next speaker tonight is Dr. Mukunda Abdul Baki. The doctor is from the Martinsville, Henry County chapter, and I would like for each individual to introduce themselves also and take it away, Dr. Abdul Baki.
Thank you so much, Mrs. Cook. And thank you, Nick, for inviting me. And it's always great to see the work that Virginia Organizing is doing. I am a transplant down south. I'm originally from the New York, New Jersey area, but I've been down here since 2007. So much goes through my head as I'm thinking about what I deal with on a daily basis and what things look like on the ground. I am a healthcare practitioner. I help women in their tenderest moment, give birth to new life. And, what it reminds me is something when I was driving with my oldest son, who was probably about 14 or 15 at the time. He said, "Mom, if America is a racist country, why does no one ever admit that they're actually racist?" And I was like, I don't know. I guess the word's ugly. And so it's easier to skirt the issue than to really deal with it. So let me give you in some ways that I think we can all relate to as far as what racism in healthcare looks like from personal stories. So I have been a strong advocate ever since the COVID-19 was, declared a pandemic, of trying to get testing in our communities. Racism in a day-to-day basis in our community looked like not being able to get free testing. For the longest time, we were not able to get free COVID-19 testing. They were like, oh, it's available. It's available, but you had to see your doctor for it. And by having to see your doctor, that meant that you had to have some type of insurance or be ready to fork over at least $100. So that means that there was not testing the way it should have been in the undocumented community. And we have a very large undocumented community in Martinsville, Henry County. It means that within the African American community, which has a high rate of uninsured, that the testing was not readily available. And so what does it look like when you get a vaccine that's life-saving. Well, what that looks like when it's dealt and there's no one at the table to address these issues of equity, what it looks like is that the people in power make a way for their friends and family to get the vaccine first. This is evident when the Martinsville Hospital was one of the first places that had the vaccine, and they made it available certainly to the doctors, the frontline workers, 100% agree with that. But then the next people that they made it available to were friends and families of healthcare workers. On paper, that may seem equitable or not something that would produce inequities, but it did, because there was limited outreach into African American communities. What racism looks like in healthcare is when you have the health department reach out to several large white churches, but never reach out to local community Black churches until one of the local pastors happens to be on the board of a certain organization, and then he was able to make certain things happen. But that's what real everyday racism looks like. None of those people would call themselves a racist. And per se, if I had, and I've had discussions with many of the power brokers in the town, I don't think I would sit and call them a racist either. But there's a difficult conversation that we have to have in America concerning what your actions say and what the effects of your actions result in. And so you may be able to, think that you're living kind of a um, carefree existence and that your decisions have no consequences, but they have very real consequences when you don't make decisions that speak on equity. During the pandemic, we had to have we had to limit visitors in the hospital. So these are things again that I saw with my own two eyes. A white patient who we limit, so when you were in labor and delivery, you were allowed to have your significant other or one person with you. So, and that's what we kept telling them, you can have one person. So she wanted her husband with her, but she also wanted her mother. She said that her mother was her doula and that her mother was her support person. And basically, white nurse calls white supervisor and makes a way for the white patient to have her husband and her doula involved. On the flip side, I had a patient who suffered severe blood pressure elevations during pregnancy, a healthy young Black mother of one, and she was pregnant with another one. She was struck blind, literally because of her blood pressures. She was blind when she woke up. She called me. I told her to immediately go to the hospital. I happened to be out of town, but I had people covering. She went to the hospital. They would not allow her husband. They would not allow her mother inside. They again said that they were following the COVID restrictions. And there was no common sense to understand that, yes, if I was a person who was kind of just, I don't know, maybe saying I had some chest pain or something like that, maybe I could go to the emergency room by myself and not have any support. But someone who was just a visual person on Monday and then blind on Tuesday, they need some assistance. But this young lady received no assistance. For the hospital, they would say they were following their protocols, and they would say that there was no racist intention. For me looking at it, that's the way it looked to me. In the end, things also happen to do with dollars and cents. In the time that I've been down here since 2007, I have seen one hospital declare bankruptcy. I've seen another hospital close their labor and delivery unit. And I've seen one hospital completely close. And in the same period of time, I've seen this area lose about 10 obstetrician gynecologists. What does that do? That you know, you've got to understand that the loss of that amount of doctors, the loss of those labor and delivery units are going to be directly correlated with poor outcomes for these moms. On the flip side, while I've been working here and understanding that I'm dealing with mostly Medicaid patients, I just realized in discussions with Virginia Premier that they just discovered that they've been underpaying me for several years. And now we're trying to negotiate and figure this out. But it's these types of things where you're basically crushing the small private practice doctor by underpaying them, and you're looking at decreasing the caregivers in the area. All of these things is what racism looks like and what contributes to healthcare disparities.
Thank you so much, Dr. Abdul Baki. We're going to move on to our next speaker, and that is Cindy Portillo. I hope I pronounced your name right. Take it away, Cindy.
Buenas tardes, mi nombre es Sandy y soy voluntaria de Virginia Organizing en Richmond, Virginia. ¿Me escuchan bien? Ok. Tengo que agradecerles por darme la oportunidad de hablar en esta vez acerca de una historia que yo conozco muy de cerca, y no es acerca de mí, sino de una amiga muy cercana a mi familia. Su nombre era Sheila. Ella se enfermó un poco antes de la pandemia y padecía mucho dolor de estómago. Entonces a ella no iba a chequearse porque no tenía seguro médico, pero cuando ella fue al médico le descubrieron un tumor canceroso en el estómago. Le dijeron que no podían operarle porque no tenía aseguranza y también porque no contaba con un seguro social. Ella trabajaba muy duro con su esposo para darle un mejor futuro a sus hijos, pero dejó de trabajar debido al tratamiento. Y su esposo la llevaba a las quimioterapias que le estaban dando, y por eso también trabajaba muy poco. Y a veces no tenía dinero para comer, ni siquiera para pagar la renta. Teníamos que reunirle dinero para comer y pagar la renta. Cuando las restricciones de la pandemia iniciaron, ella tuvo que dejar las quimio porque dijeron que iban a darle solo tratamiento a las personas que tenían seguro y que contaban con un número de seguro social. Entonces su cáncer avanzó y ella enfermó mucho. Le dijeron que estaba desahuciada. Sus niños sufrían mucho emocionalmente, estaban muy deprimidos, no comían. Ella les mandaba a dormir temprano porque no tenía darles para comer. Y después de eso, le dijeron que ya no le daban más tiempo de vida. Y los demás días, ella enfermó, se contagió de coronavirus y terminó por morir. Dejó 4 niños, una niña de 13, un niño de 11, un niño de 8 y una niña de 3 años. Todavía puedo recordar cuando la niña lloraba pidiendo que por favor curaran a su mamá. Eso nunca lo voy a olvidar. Para mí ese es un claro ejemplo de injusticia racial. Eso es todo, gracias.
Thank you very much, Cindy. And I forgot to say that Cindy is a part of the Richmond chapter of Virginia Organizing. Our final speaker for the night is Chloe Edwards. And Chloe is with the Voices of Virginia's Children.
Hi, everyone. I first want to start off by saying thank you, Virginia Organizing, Delegate Aird, fellow panelists, and other advocates for your tireless advocacy and for sharing your truth tonight. And thank you, Cindy. It makes me so proud and so honored to work alongside all of you in acknowledgement of the tribulations our communities face, but also the triumphs and the great resilience that has been passed down intergenerationally. So in honor of Juneteenth, I truly believe we are our ancestors' wildest dreams. I want to secondly acknowledge that communities should not have to be resilient. Our system should instead foster resilience. We must change the systems that perpetuate racial trauma instead of further maintaining them. So Voices for Virginia's Children was pleased to champion House Joint Resolution 537 through our Racial Truth and Reconciliation Virginia campaign, which works to empower marginalized communities and acknowledgement of their truths to promote healing, reconciliation, and justice. It's important to note that the impact of racism on children and families across the state is disparate. Racial trauma results in the ongoing exposure to racist abuse, while young children do experience racism and even internalize it. In the 1940s, psychologists Kenneth and Mamie Clark conducted a series of experiments known as the doll test to study the psychological effects of segregation on Black children particularly. A majority of the children preferred the white dolls and assigned positive characteristics to the white dolls over the Black ones. The Clarks concluded that prejudice, discrimination, and segregation create a feeling of inferiority among Black children and damage their self-esteem. According to our Kids Count data center at Voices, which includes indicators such as socioeconomic hardships, family violence, neighborhood violence, and racist bias, 19% of Virginia's children experience 2 or more adverse childhood experiences. However, Black children experience 2 or more adversities at almost double that rate than all children in comparison. This can contribute to toxic stress in the brain, which is known as trauma, and this is connected to long-term negative physical, social, and emotional health outcomes. Historical traumas, such as slavery, the Indigenous Trail of Tears, the separation of children and family at the border, redlining, the Holocaust, and other historical examples can transmit trauma across generations through epigenetics. Even when families have not experienced the trauma directly, future generations can still feel the impact. Racism is a determinant that impacts public health, whether implicit or explicit, it's ingrained in every component of our society. So I encourage you, even as we return from the pandemic, let's not forget all that has brought us here today and the lives lost. In 2021 alone, we still await justice a year after the death of George Floyd due to police violence. Justice for Ma'Khia Bryant, who was only 16 years old. Justice for Daunte Wright. Justice for Matthew Williams. And collectively, as we are continuing to start to experience a sense of normalcy as we return from the pandemic, we must not forget the progression that we have taken. We must look at how racism is a determinant of health across every single system: criminal justice, family economic security, health and wellness, mental health, and more. And so I challenge you to maintain the level of momentum that people had last year when the pandemic first started, when we were marching the streets. And let's not forget that these problems still persist deeply in our society, and we still have much more work to be done. Thank you.
Thank you, Chloe. We're now going into the question and answer period. If you have a question, we would like for you to go into the chat room to put your question and put the speaker in which you're directing your question to, so that we can get started. If we go over 7:30, please stay on with us, because we want to make sure that we cover all of the questions and give ample time for people to ask questions. So do we have a question?
No.
This is Sally Mae Polly. I have a question. This is Sally Mae Polly. Can I speak now?
Go ahead.
I have a question for Ms. Aird. So I have an experience as a deaf person And I'm also a deaf advocate. I work as a deaf interpreter for mostly Black deaf individuals who have language delays. And I did that work before COVID. I did it a little bit before COVID, but now since COVID, I was doing it a lot actually. Currently, more and more hospitals are, I can give you an example, like if a Black person is there first, a Black patient is there first, and then a white patient comes in, the white patient is generally called before the Black patient who has arrived first. And I've noticed this over and over again in my work as an interpreter for these Black patients. So I'm wondering if you can advise about how that I can help this behavior to stop. What action can I take to stop that? Because it's not just in hospitals, but also, you know, I just have noticed that in general, white people are served before Black people, whether they be consumers or something else. So I would appreciate your comments on that.
Well, first, thank you so much for the question. And thank you for even observing this behavior occurring. The one primary piece of advice that I'm going to offer that is the easiest to accomplish is offering this feedback to both the leadership of the hospital that you are conducting a business in. I'm going to speak to the hospital specifically because I think that's easier to answer at the onset. But then also direct advocacy as these incidents are occurring, which is beyond observation. When this is happening to a patient in real time, questioning the behavior or asking for a rationale or explanation as a result of that behavior. Does that cause more work on your part? Could that cause tension within the interaction? Possibly, but silence allows this behavior, and not to say that you're silent, but in the event thereof, silence allows for this behavior to go on unchecked. Relative to my role, if this is happening at a hospital regularly, especially, please let me know. As a legislator, one of our primary roles of responsibility is constituent services. And that means I am chief liaison on behalf of the people I represent to call out inequities and injustices when they are occurring. And even if it was not something that was race-based, I already get concerns from individuals who are visiting hospitals or even any of our mental health care facilities, nursing homes, private or not, about injustices that they experience and wanting to notify someone that this is going on. And so that is the easiest way I could answer that, but I would love to know when and where this is happening so that I may be able to explore further on the behalf of those who are experiencing this.
This is Sally Mae. Yes, you have to understand, you know, for myself as an interpreter, you know, it's not my position to make these things known. I prefer and hope that the patient would actually speak up for themselves. And I tell the patients sometimes, you know, you need to speak up, but a lot of times Black deaf individuals are afraid to speak out. I go to one particular hospital where I am actually a patient. And in that particular hospital, that's not going to happen because everybody there knows who I am. I have set up my house interpreter that I am familiar with. And when I need to go to the hospital, I go to that hospital and the services are provided for me. But it's just other hospitals where deaf Black people go. And myself as an interpreter, I am not in the position to be able to speak out for them on their behalf. So it's just something that the Black deaf patients themselves need to be able to learn to speak up for themselves, and oftentimes they feel a little bit intimidated and not able to do that.
Thank you very
So
much.
it is a sticky situation.
Karen is
Make
in
one
our,
more statement.
go ahead, Delegate Aird, and then I'm gonna have to go to the next question.
I'll be very brief. And Sally, I don't even really think this is specific to your question anymore, but I'm going to say this because I think it's timely in this moment. You know, when the racial reckoning was occurring around this country at the height of George Floyd and Breonna Taylor, I'm going to be very blunt in saying this, but I had so many non-people of color asking me, what should I be doing? What should I be saying? How can I be helpful? And I think for some reason during this period of reckoning, non-people of color think that they need permission to advocate, that they need approval or guidance to advocate because they're unsure or perhaps it's not happening to them directly. But I will say, specifically for non-people of color, you have agency and a responsibility to advocate, especially if you recognize injustice occurring. Is the duty assigned to you specifically? No. But if you know and you're not courageous and do everything you absolutely can without someone of color asking you or telling you to do so, that is equal to the injustice that you are observing. So I just wanted to add that because I think that is so important as we move forward, especially to truly address this issue of racism.
I agree 100%, Delegate Aird, and not to do a pile-on or anything. It's beautiful that you recognize the disparity, but it's equally important that, especially when you're already saying that your clients don't seem to have the power, the agency, the strength to speak for themselves. It's important that you're recognizing it. That's the first step. The second step is to say something about it. And it is difficult. It's difficult when I have to call other people out on stuff. It's not something that I enjoy. And, you know, because people's feelings get hurt. And I'm sure, you know, they'll tell you a million things as far as why they're calling one person back before the other. But, you know, no one's going to jump off the deep end if it just happened once. But if you're seeing repeatedly with different clients, every time you go, you get there at 10 o'clock, a white person gets there at 10:05, and the white person gets called back, and you and your client are sitting there, and you're seeing this happen repeatedly, you know, you don't have to make a scene about it, but there are definitely coursework around being someone who stands up, who is a defender. So I agree 100% with what Delegate Aird said. Now is the time to have these difficult discussions. They're hard to have.
Okay, thank you so much. We're gonna go to Karen Downey from Eastern Shore with her question, please.
Good evening, everyone. This question is for Delegate Aird. And recently I was on a virtual meeting with Dr. Underwood and staff, and they rolled out the Equity at a Glance dashboard. So my question is, what do you believe, or what changes do you believe that those indicators on the dashboard may be able to bring about in our localities?
Great, thank you so much for the question. I actually believe that this dashboard is critical to being able to bring about the change in our localities, because oftentimes these indicators are not measured. And this allows us to both establish a baseline, but then it also allows us to monitor and track whether progress is or is not occurring. Now that these dashboards are now available, it serves as an additional tool, both for decision-making and for awareness. And so there is a lot of work to still be done relative to encouraging the use of these dashboards. But once they are adopted and properly utilized, I do think relative to decisions, at the local level, policy decisions, and as well as accountability on behalf of the people in those communities that are represented by these leaders. They now have something to point to say whether or not the decisions that are being made are working.
Okay, thank you very much.
Okay, we have our last question, and our last question is going to come from Sheila. Sheila, you had a question? Sheila Stone.
I could. I guess my question has to do with the disparities among the healthcare workforce and who's doing the most, the 3Ds, dirty, demeaning, and dangerous work in the healthcare system. And I don't really know how to fix it at all.
Dr. Abdul, could you, Baki, could you answer that?
I mean, it's what you would think, and that's what's been borne out by the people, you know, that have died with COVID. The dirty, demeaning work is the, you know, the people who have to do all the cleaning. Those were people that should have been, you know, put ahead of pretty much everyone else to get N95 masks and proper equipment to clean. But the cleaning crew, anything that is kind of low pay, low educational attainment is going to be flooded with Black and brown people. Black doctors only make up about 4 to 5% of the workforce. So we are few and far between. So, you know, so those are not, it's everything that you think, and it's everything that you see when you go to get care. So the people who clean your room, the people who wash the clothes, the people who may come in and draw blood, the people who work in the cafeteria, those are all going to be predominantly Black and brown people.
Thank you.
Yeah, I was going to chime in too. So some of the themes that have been brought up today, Voices is working on, I particularly lead our social determinants of health work around community health, wealth, and justice. And then we are also home to the Racial Truth and Reconciliation Virginia campaign. But we're seeing themes around language justice, which was mentioned earlier today. The state doesn't quite have a robust infrastructure in place for language access work as it relates to interpretation, someone there that can actually culture relate to the person getting the services. We do have some translation services, but it's not quite a system put in place to make sure people are getting culturally competent and appropriate quality of care. So this is something we're looking into. We have had some conversations with the Virginia Interpretation Translation Association, the Office of Newcomer Americans Services, et cetera. And so we have made some leeway with the Marcus Alert. For those who aren't familiar with that piece of legislation, we were able to put in some language around infrastructure, but that state plan still has to be proposed. This is something we'll continue to follow. For undocumented children specifically, there is a lot of momentum around increasing access to care. Other states have done this. In Virginia specifically, we have made some leeway through the Famous Moms program to provide access to healthcare for immigrant mothers specifically that may not be here legally, but we'd like to see this across our health care system, especially for children. And so we are working on the work group for that. I think at the next meeting, we'll be reviewing some other state plans to see how we can get this implemented in Virginia. I'll stop there. We are also looking into community health workers, which is the last thing I'll say. They're working on standardization statewide. which has been kind of one of the barriers to getting community health worker funding, just not having the standards. And so they are working with VDH on standards and have applied for a CDC grant through the CARES Act funding to increase our infrastructure here in Virginia. With the American Rescue Plan coming, we do know that we could possibly tap into these funds to get more funding for our community health workers. These are people that are trusted in the community and, like you said, are often underpaid. And so we think that this will get at, not just health education, but community health workers provide peer support services. They're in your pharmacies, et cetera. And so this is also something that we're looking into. But a lot of these issues, like I said, we just don't have the infrastructure in place. And so we'll need to do a lot of research to find a solution and connecting with you all too.
Thank you so much to all of the panelists tonight. We realize that we have a lot of work to do. Virginia Organizing has been working on dismantling racism for 25 years, and we're in it for the long haul. The last thing that I'd like to do is to call on Patrice Smallwood for our call to action. Again, thank you to the panelists.
Thank you, Sandy. Good evening to everyone, and thank you again to Delegate Aird and all of our panelists. This has been a wonderful discussion. I'm with the Norfolk chapter, and one of the ways that we've worked to dismantle racism in our healthcare system is by ensuring COVID vaccinations were distributed to the vulnerable community. And so many of us on the call today witnessed the lack of fair and equitable distribution of vaccines here in Virginia. Even though we were one of the largest populations, we were one of the last to receive vaccines in the early phases of distribution of the COVID vaccine. So in our chapter, we wanted to make sure vaccines were being distributed to unhoused, undocumented, and incarcerated persons. And when we learned that none of the inmates in our local jail were vaccinated, we made sure to call out the health department to take action. And so today, as a call to action, I want to encourage every chapter represented on this call and every person on this call to reach out to your local public health officials and others to find out what you might be able to do in your local area to dismantle racism in our healthcare system. As we celebrate Juneteenth tomorrow, let it not just be a day off, but let it be a day that we truly honor those who have fought so long and so hard for us to have our freedom. And so again, the call to action this evening is for everyone to contact your local health officials and other persons, health departments, and find out how you and what you can do to help dismantle racism in the healthcare system. Thank you.
Thank you, Patrice. And we have one other call to action. Isaiah.
Hi, everyone. My name is Isaiah Martinez, and I'm a summer fellow with Virginia Organizing. I just wanted to spend some of these last few minutes talking about voting. With so many important elections coming up and so many issues relevant to our communities, I hope you all will show out, go vote, and encourage and help members of your community to vote as well. It's one of the best ways we can be involved in the civic process and hold our elected leaders accountable. While voting isn't the end-all, be-all, we do know that it can be a great step in making the kind of change that we want to see in our communities. For more information on voting, you can go to elections.virginia.gov to register to vote. To have voting rights restored, you can visit restore.virginia.gov. And finally, always feel free to email info@virginia-organizing.org if you have any questions. Those links have been put in the chat. Thank you all.
Okay, we've come to the end of our seminar tonight. As I said earlier, we have a lot of work to do, and we're in it for the long haul. Thank you, everyone, for taking out your time this evening to be with us. Thank you to the panelists, everyone that was on the call. And we have to remember Racism as a Public Health Crisis in Virginia. Let's keep working on it. Good night.
Good night. Thank you very much.
Thank you, everyone. Have a good night.
Take care, everybody.